why had previous media campaigns on this topic not really worked?
I think that, you know, it depends how you assess the effectiveness and whether they've worked or not. I mean, I would say, for example, as a health promotion person, that I don't think using fear, as they did in the Iceberg and Tombstone campaigns, is necessarily an effective tool, because you can't possibly sustain that, and in my view, it distances people from real day-to-day living. Having said that, if you want to create quick awareness over a short time scale, you know, that is very effective. I think that, you know, awareness of the term AIDS shot up to almost 100% within weeks of that advert going onto the television. So did it create awareness? Yes. Was it successful in that terms? Yes. Did it make people feel that HIV was something that they might encounter? No, I don't think it did, because it was something that did happen to, well, the drug addicts, the gay men, and it was never going to really affect me. So I think that that was the problem the HEA was faced with, that people knew what AIDS were, usually had some misunderstanding around how it was transmitted. And so our first task, I think, was to perhaps move away from the peaks and troughs of television and to use something like the broadsheet media and the press and the radio to have a more kind of sustainable drip approach, giving pieces of information out that made people connect to the issue, and that made sure that they were not their knowledge wasn't based on myths and misunderstandings, but on the facts around HIV and AIDS, which makes it a less sexy, less impactful campaign, but in the long term perhaps will, you know, produce a better approach.
And how was the subsequent media and advertising campaign conceived, and which agency did you work with, and what was their contribution to that?
Well, we TBWA had done the Icebergs campaign for the government, and because we were changing strategy so much, we decided to go with a new agency, and BMP were the one we chose. And they were, you know, very instrumental, because they were the professional experts. So we may say to them, this is the message we want to communicate, and they would say, well, this is the most impactful way it can be communicated. But as health promoters, that might not sit comfortably with us. So they were very good at saying, you know, putting the kind of professional media expert view and saying, well, if you want to say something and you want impact, this is the most impactful. This will give you, you know, a middle range, which perhaps we would often go with, because that would be less controversial, and therefore we wouldn't get the constant editorial around it, and negative editorial, which would sometimes undermine what we were trying to say. So they were quite a thoughtful agency and understood the kind of political, sensitive nature of what we were trying to achieve. But we had a very clear strategy following the kind of initial campaign, because we had, I think the first stage was to focus on giving the facts over and looking at personal responsibility. So to say, you know, you're as safe as you want to be, the decision is yours, so that people were not distancing the issue away from them. And we used press mainly for that. We then went on to a campaign which used experts, so the scientific community, the clinical community, because there's quite a lot of controversy around heterosexual transmission. Was this something we were making up? Was there the numbers that were predicted? And so we used authoritative figures face onto the camera to say, you know, if you are sexually active, you are at risk. So to put that to bed, really, and to say to heterosexuals, this is an issue for you. We then went on to do a kind of personal testimony, again TV campaign, which sort of humanised the disease, because we found from all our research that people were saying, well, it won't happen to me, it happens to the others. So this was about ordinary people, again heterosexuals, on camera, talking about their ordinary lives and how HIV had impacted on that. And then eventually, as we were moving through and looking more at sort of sexual health and sexually transmitted infections alongside HIV, we moved on to the normalisation of condoms phase, which was about getting young people to use condoms, and to
eroticising the use of.
Well, I think in the gay campaign we did eroticise condom use a bit more than we did in the general public one. I mean, we used Mrs. Dawson, who was an old lady working in a condom factory. I don't know if you can remember the image, and Mr. Brewster. So not particularly erotic ways, but these were older people who were talking about condoms. So we were trying to say it's okay. Everyone talks about condoms these days. Everyone should be using them. So I think that the British way is not always an erotic way. If you look at France and some of the kind of European countries who used either eroticism or who used humour or who used cartoons, I mean, I think they were ahead of us in that sense, but it was very European what they were doing, and not necessarily the kind of thing that would sit comfortably in this country. And I think as we moved towards the end of that, we were beginning to see ads that would sit comfortably in women's magazines, men's magazines, so they were stylish and they were a bit more, not so much a public health announcement, but more in tune with what other young people were seeing in their magazines. And then I think more latterly, the key thing really in terms of communicating with the public, apart from the condom message obviously, is the stigma and prejudice that still exists today around HIV and AIDS. So I know that, I mean, the HEA didn't get involved with this because by that time the campaign had moved, but I know that the National AIDS Trust have had a campaign running on stigma and prejudice and challenging people and saying, these are ordinary people, why do you feel negative towards them? So I think that's been the kind of the message in more latter years, really.